Hello and welcome to Group 3's presentation. Today, myself and Duchana, Annie, and Rebekah will be talking about conduct disorder. Conduct disorder is defined by the DSM as a repetitive and persistent pattern of behavior in which the basic rights of others or major age-appropriate societal norms or rules are violated. It is commonly found in children and adolescents. Teens with this disorder have difficulty following rules, a lack of respect for authority figures, and their behaviors is not socially acceptable. Teens with conduct disorder may have some of the following behaviors: aggression toward people and animals, destruction of property, deceitfulness or theft, serious violation of societal rules. It is defined as an ongoing aggression. The teen may bully other peers as well. The teen may be cruel to animals. The teen with conduct disorder breaks serious rules that require police attention. The police may step in and punishment from law enforcement may happen. Trauma is listed as a cause of conduct disorder. Conduct disorders are problems with control over one's emotions and behaviors. Conduct disorders differ from other emotional and behavioral problems because conduct disorders affect other people, not just the patient. Treatment can be challenging. Treatment depends on the severity of the condition. Behavior therapy and psychotherapy are used together to help change patterns and behaviors. Medication treatment is also available for sometimes as well. This next slide shows conduct disorder development. So there are two factors. There's the environmental factor and the dispositional factors. First, I'd like to talk about the environmental risk factors. First, in utero, maternal factors such as smoking, alcohol use, drug use, and stress can contribute to conduct disorders. And then at birth, birth complications, maternal or paternal psychopathology, malnutrition can also contribute. During childhood and adolescence, harsh and inconsistent discipline, parent-child conflicts, maltreatment, low socioeconomic status and poverty, the community violence association with deviant other peers. And then there's the genetic factors as well as the autonomic, the neurocognitive, social information processing, temperament, and personality traits that can all affect conduct disorder throughout the in utero to adolescence.
Okay, I'm Rebekah, and I'm going to talk about why conduct disorder is important to the field of counseling. The kind of just quick answer to that is because it is extremely common, and it also relates to many other counseling topics. So first, conduct disorder is extremely common. So Mental Health America actually says that among both boys and girls, conduct disorder is one of the disorders most frequently diagnosed in mental health settings. And so that is significant in the sense that more than any other disorder, conduct disorder is one that is diagnosed the most. It's more frequent in guys than girls. Guys are diagnosed with it 6 to 16%, and girls are diagnosed with it 2 to 9%. Conduct disorder is also important to counseling because it relates to many other topics that involve counseling. So first, there are many risk factors of CD. Some of these include having a parent or sibling who has CD, different things with parents. So like they have alcohol use disorder or other substance abuse disorders, parents with schizophrenia or depression or bipolar disorders. If the child had or the teen has experienced abuse or neglect or harsh parenting, those are all things that put a child at risk to developing conduct disorder. And then one thing I specifically wanted to talk about a little bit more in depth was family attachments, and how that is a specific risk factor of CD. So there's an article by Ozturk and his colleagues, and they researched, what they did is they experimented and put families through an attachment-based program. And so what they found through their research was that throughout the duration of the research and the course, parents and families that experienced a stronger attachment observed less external behaviors in the children. And so this is specifically related to the level of relationship that they felt like they had with their children. And so it was just really interesting to see specifically how family attachments are extremely related to conduct disorder, and stronger attachments lead to less negative external behaviors. Other aspects of counseling topics. So there are a few of the ways that conduct disorder manifests, and Lindsey talked about this a little bit, but it can be manifested in exhibits of violence or risk-taking behaviors, physical injuries from accidents or fights, and then also problems in school. And so it's important as a counselor to be aware of conduct disorder, because these are pretty significant manifestations and things that would need to be addressed. And so therefore it's important for counselors to understand conduct disorder. And then finally, conduct disorder relates to other disorders in the future. And so it puts teens at risk for future disorders such as substance abuse disorder, antisocial personality disorders, specific learning disorders, anxiety disorders, and depressive or bipolar disorders. And so it's important for a counselor to understand CD so that they can help work with them. And Annie's going to talk with that later about treatment strategies, but in order to prevent against these other future disorders.
Hi, so I am Duchana, and I am going to be sharing about the relevance of CD in minority or non-dominant populations. So first, I wanted to discuss minorities and the risk factors. So according to this source, Canino, risk factors associated with conduct disorder include poor prenatal care and poor infant nutrition. So maternal care and mothering and how children are doing in the womb affects CD development, as well as exposure to toxic and infectious agents, living in disadvantaged or crime-ridden neighborhoods, negative environments, and this is all more common in ethnic minorities. So this puts children and adolescents in these environments more at risk for developing CD in the future. So next is bias and disparities in diagnosis of CD, as well as some statistics. So research suggests that African Americans, Asian Americans, and Hispanic youths are more likely to be diagnosed with conduct-related problems than white youths. So a thing that's in play here is unconscious biases, which all people need to be aware of, especially counselors and clinicians that are trying to diagnose during their treatment plans. So unconscious biases may play a role in a clinician's diagnostic decision-making, which can lead them to judge and interpret behaviors seen in disorders such as CD differently based on race and ethnicity. Something that I came across in my research that was really interesting was about systemic injustice toward minorities when it comes to psychological diagnoses. So this can lead to labels such as CD, which can lead to systemic, a cycle of structural racism. One psychiatrist named Matthew Fadis says that children can end up in this self-fulfilling prophecy where they may be seen as less innocent or more aggressive or more dangerous than their peers. So in turn, they respond with more defiant manners as well as more aggressive manners. So all of this research showed me that it is so important as counselors that we have competence in multicultural counseling, but then also for each of us to be aware of our own biases, our own stereotypes that we have in our minds about other people, because that will affect our profession and how we work with others. Some statistics that I came across were that the lifetime prevalence of conduct disorder is about 6.9% in Hispanics, 4.9% in African Americans, and 5% in white youths. White children are more likely to be diagnosed with oppositional defiant disorder, while African American children are more likely to be diagnosed with CD. Male teens, minorities, and children from low-income families are more likely to be diagnosed with severe problems linked to neurological attention deficit disorder, and conduct functioning. All of this shows that minorities are more at risk for development of CD, and it's really important for clinicians to be aware of whatever biases or disparities when it comes to this diagnosis. So next, Annie is going to be sharing about treatment.
Annie, you're muted.
So the current treatment strategy for adolescents with CD is a multifaceted treatment plan with emotional focused therapy, according to an article that I found in Journal of Mental Health Counseling published in 2019, October of 2019. This is I think, in accord with scripture and our biblical worldview of Ephesians chapter 4, verse 22 to 24. You were taught with regard to your former way of life to put off your old self, which is being corrupted by its deceitful desires, to be made new in the attitude of your minds, and to put on the new self created to be like God in true righteousness and holiness. The multifaceted treatment plan that I found in this article is what it does is it takes the youth with conduct disorder out of their environment and puts them in a residential treatment facility. And this is common. Many youth with the diagnosis of CD are sent to residential treatment facility. And within the confines of such a facility, they're away from their family, their school, whatever is triggering their behavior. It's an ideal scenario for them to be able to reflect and learn and grow from their treatment. So with an individual emotion-focused therapy, the counselor acts as the attachment figure in this safe environment. So the counselor provides a stable and consistent attachment figure to stimulate reflexivity in a therapeutic space focused on processing emotions and their impact on others. This treatment modality allows the youth to examine patterns of emotional reaction and work with the counselor to learn to trust their own emotional experience and others. The article gives a good real life description of a case example of a youth that came in with this diagnosis. The youth was initially angry at being there. The counselor, because he was residential, got to spend time with him and develop a relationship with him that allowed her to, with that trust, develop and demonstrate what a caring primary caregiver, how a caring person acts, and also explain how his disruptive reactions were what he was feeling when that was happening, because he couldn't put a name to it, and also how it was impacting those around him. So this residential treatment facility and emotion-focused therapy provides a more flexible way of expressing emotions that does not just teach the skills, but changes the embedded attachment strategies that lead to more adaptive ways of relating to parts of self and others across the settings. Ultimately, trusting oneself to express a range of emotions and being able to regulate these emotions leads to healthier behavior choices for the adolescents with conduct disorder. Now, one of the limitations of this treatment is what happens when the youth goes home and goes back to his home environment. And the best way, according to this article, the best way to counter that is to involve the primary caregivers in the treatment process at the residential treatment facility to some extent as they can, but also to encourage, once the youth is discharged, the family to continue some ongoing therapy as well. And of course, cultural sensitivity is important throughout this. The counselors have to keep in mind that the effect of the gender of the client, the age, and the culture may have on the way that their clients express and process their emotions. They just need to be culturally sensitive to the challenge that some clients are going to have expressing their emotions and naming them and processing them, and especially in their family environment. So in conclusion, our group has found that conduct disorder is more than just misbehaving. It's a disorder with serious implications. There are several factors that put a child at risk for conduct disorder. Counselors need to evaluate family dynamics and parenting in treatment of children and adolescents with conduct disorder. Minorities and children from low-income families are more likely to be diagnosed with conduct disorder. And removing teens from an unhealthy environment allows them to reflect on how their behavior has impacted their lives and others and grow from there. Recommendations for future study would include what is the prevalence of conduct disorder in Asian American children. We did not find any literature. We found literature on many other cultures, but not the Asian American culture. And how does parental training affect the severity of conduct disorder development? Is there something parents can be trained to do that would prevent it from developing? And then what is the line between misbehaving and the display of conduct disorder? How does that diagnosis of conduct disorder, what triggers that specific diagnosis? So those are the areas that we found for recommendations for future study.